Once again, hello. Once again, good morning. So this is the third case. The third case is also a case in which we will use this combination that I think it's one of the best that we have in 2025. I mean this laser, this laser Thulio. It's a great laser, and as I told you, it's a combination. It's, I don't know, maybe between holmium and thulium, having the qualities of both. And at the same time, we have the ureteroscope. I mean the HugeMed. This is 6.3, and will be really, it's a very good technology, and we appreciate a lot. It's this ureteroscope we use already from about 2 years, and in 2025, 6.3 is one of the best in articles, in experience, in everything that means new techniques in endourology. And these three cases, now we will start the presentation of the case, and after that we will proceed to the operation. So please, presentation of the case.
In this case, we will perform surgery on a female patient of 73 years old with a pelvic stone of 13-10 5 millimeters dimension, a stone volume of 338 cubic millimeters, a stone density of 1,400 Hounsfield units, and of course negative urine culture. As equipment for this case, we will use a single-use flexible ureteroscope from HugeMed HU30M with a 6.3 French diameter and a 3.6 French working channel, a steerable access sheath from Wellead, Polaris loop ureteral stent, and Thulio laser system.
Okay, so today, for the third case, as I told you, we use this great machine. I told you about this Dornier. It's really a great machine, and I put already 300 microjoules with 50 hertz. I change a little bit the coordinates, and also we will have this one. It's very important. It's Wellead with possible active deflection. It's really completely new, and that's why, because in this case, it's a stone into the inferior calyx. It's a big stone in the pylix, in the middle of the kidney, but also it's a stone in the inferior calyx, and this in acute angle. So sometimes it's difficult to enter here. That's why I put this access sheet, this new access sheet, that so we will have double active deflection. This is really very good. So we will use also the HugeMed 6.3. It's really very thin. It's the thinnest urologist, thinnest ureteroscope in the world, and you will see how we put. It's very easy. The patient has already the access sheet in place, and we will enter into this sheet. Look, this is the ureteroscope, very easy, and look here, it's a very good flow, irrigation. This is very important. So no pressure into the kidney. Without this, it's quite difficult to make a very good and very safe ureteroscopy. So move. We are now into the access sheet, and now we are in the ureter. This is access sheet, and now let's see. No, we are in the in the middle of the kidney, it's a stone. Look to the stone. It's another story. It's a black stone. It's very, very strong stone. You can see here. It's and the superior calyx is okay, but look, it's edema. Its importance is because the stone it's here from some time, so then yes, now the fiber is here, so please fix the fiber. Fix the fiber, okay? And now we need water. Perfect, very good, very good. And now let's try to disintegrate this stone. Okay? The disintegration of the stone is like that. We move the surface of the stone like this, and like this, and like this. Okay. Very efficient also this Thulio, very, very efficient. I change a little bit the power and the frequency. Give me the date. It's 300
millijoules and
50
hertz.
50 hertz. Good. 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 Look, this is like a star. Here it's the exterior of the stone, and here is in the middle. Very nice image. It's you know, you must be urologist, must be also you must make a poetry, no? Very nice image. Look, it's working perfect. Is perfect working. Now I am very close. Do you see to the wall? Be careful. What is the volume of this stone, Christine?
240 cubic millimeters.
Ah, it's not big. Good. It seems bigger. Yes. Now it's possible. Look, this is the superior part of the stone, the superior board. Okay. Okay. And now I will try to enter here. Yes. Very close to the wall. Very close. Very dangerous. Look. It's here. Exactly. So in this kind of treatment, you know, now we have to disintegrate the fragments. Sincerely, I don't like much this system because it's, you know, I prefer, you know, to obtain from the beginning the real dust, because this is time consuming. Also dust is time consuming, but finally I am much satisfied with the system in dust, not in fragmenting. We are very close to finish this case. We need to see exactly the inferior calyx, I mean this initial image with a stone there. Quite good. Look, this is, now I need suction. Suction is this, look. This system of suction, it's something that in 2025 it's already a standard, because you need to give to the patient the real stone-free, and stone-free real is without stones, without fragments, despite the fact that the fragments may be, you know, there are less than 2 or 3 or 5 centimeters. Okay, but it's not enough. To be sure and to be correct to the patient, you need to have these fragments out. Look, like this. I was in the inferior calyx, and look, it's wonderful, wonderful situation. Completely finished. Look, let's see here. Here it's a calyx, I think inferior calyx. Let's see. Maybe here is the initial stone. Yeah, this one also. Okay. Another fragments. Point 3, it was impossible to enter here. Now it's possible. Look, we are into the calyx, and it's free. Look to this entrance, very, very narrow. This is the utility of 6.3. Great utility, great. I think it's okay, so we can put a double J, and we finish the treatment completely. It's stone-free. Okay, so please put the double J. It's perfect, please.